Thanks very much, Marty. Good morning, everyone. This is Sean Idonato. I'm the CEO of Kineta. I'm here with my colleague, Craig Phillips, who is joining me. I'm a scientist by training. I've worked in the biotech industry really my entire career. That is my second company, which I founded here in Seattle. Our previous company was a company which was venture capital financed, exited in an M&A transaction in 2008. And we're happy to be here today telling you a little bit about Kineta.
What are you doing?
I'll look forward to having Craig Phillips, our president, step in and introduce the company, and then I'll pick it up from there. Thanks, Craig.
Great, thanks very much, Sean. Yeah, we're here to talk to you about Kineta. We're developing novel, first-in-class life science technologies, really to treat cancer, and especially focused on hard-to-treat cancer.
No.
In fact, can I ask, someone has their speaker on and a dog barking. If you could mute yourself, that would be appreciated. Thank you. So I'm going to talk about what our research programs are. You know, as a company, we're based in Seattle. We're really focused on innate immunity, and that's really the center of our expertise and focus. The market sectors that we're looking at are immuno-oncology, which is the largest growing market in the pharmaceutical field. Our first drug program we're going to talk about today is an anti-VISTA antibody. And this is a monoclonal antibody that reprograms the tumor microenvironment. And what that does is that allows the immune system to regulate and control itself, thereby suppressing and killing cancer cells. So this is it's a novel drug program. Sean's going to do a bit of a deep dive into this morning. And we're looking to file our IND at the end of this year. We also have a novel drug for chronic pain. This is a non-opioid alternative for chronic pain. That drug's currently in phase 1. And we've licensed that drug to Genentech Roche on a worldwide basis. So we're really working with them to advance this program through the end of phase 1. And at that time, Genentech takes over full control of the program. So novel research focus. On our next slide, it just shows kind of where each of these drugs are in development. In addition to the VISTA program we're going to talk about this morning, we also have a discovery program in immuno-oncology, and we anticipate designating another program out of that research effort late this year or beginning of 2022. And we also have a legacy program that's focused on emerging viral diseases. It's a viral fusion inhibitor, and that's predominantly funded with non-dilutive financing from the NIH and other NGO organizations. And so with that, I'm going to turn it over to Sean to walk through the science. Thanks, Sean.
Sorry, thanks very much, Craig. It's a pleasure to be with everybody. As Craig pointed out in his opening description of the company, Kineta is really a biotechnology company that's focused on new drug development in the immuno-oncology and neuropathic pain markets. Immuno-oncology is our major focus, and one of the reasons for this, or the major reason for this, is it is the most active commercial market in the pharmaceutical industry. It's about an $88 billion market today. It's expected to grow to $158 billion by 2024. And certainly most of the institutional funding that's going into biotech companies is going into immuno-oncology companies. They constitute about half of the licensing and M&A transactions that occur in the industry every year. And they're also about half of the companies that have gone IPO over the last 3 years. And the sector has seen a very active IPO market. So immuno-oncology is a solid area for our company commercially. It also happens to be an area where I've worked in for most of my career. And then the neuropathic pain and neuroscience markets more generally are also a very active area, and they are actually second in terms of deal activity. And overall about a $6.3 billion market, mostly dominated by generic drugs. but expected to grow to 10 billion by 2027. So Kineta's principal focus is in cancer and in solid tumor in particular. And as you probably all know, cancer is a major public health problem in the United States. There are about 1.8 million newly diagnosed cases of cancer in the US every year, and that leads to about 600,000 cancer-related deaths. So that makes cancer the second most frequent killer in the US after heart disease or cardiovascular disease. And there are nearly 20 million people in the US living with cancer. And some of the types of cancers that make up the bulk of these tumors are really some of the most difficult to treat. So prostate, lung, colorectal, and breast are really the most common forms of cancer. While we've made some headway, I think, over the last decade in improving diagnosis and treatment of breast cancer, a lot of the other most common types of cancer that I just mentioned are really treated with very conventional therapies. And so new things are needed for these patients, especially patients who are diagnosed with advanced or metastatic cases who generally are more difficult to treat than when cancer is diagnosed early. So Kineta's approach to cancer is really focused on a branch of the immune system called the innate immune response. I think when many of us think about immunity, we think about the adaptive immune response. These are things like antibodies and T-cell responses that emerge over time, for example, following a virus infection or vaccination, and you need more time to develop that adaptive immune response. But the innate immune response can be thought of more as the first responders of the immune system that typically will become energized and come on within a few hours of infection. And the innate immune system is unusual in that it helps to modulate the adaptive immune response. So it can either be pro-inflammatory or it can be immunosuppressive. And having that really appropriately dialed in innate immune response initially is very important to having an adaptive immune response. And we think one of the major challenges in cancer therapy today, in particular cancer immunotherapy, is that we have an absent or immunosuppressive innate immune response, and that's really preventing the immune system from detecting those tumors as foreign and developing a robust immune response to tumor. Now, one of the major targets that we're really looking at is a target called VISTA, and VISTA is a drug target which is expressed in colder tumors. It is an innate immune target, and it is a target which is really representative or characteristic of those tumors that have an immunosuppressive tumor environment. They have a lot of those innate immune cells that are in there. They're immunosuppressive. They're blocking recognition of the tumor by the larger immune response. We tend to characterize these as colder tumors. Over the past 10 years or so, we've seen the emergence of first-generation immunotherapy in the anti-cancer space, and that has been through a couple of different treatment types called checkpoint inhibitors. And what's most interesting about checkpoint inhibitors is that they tend to work best in people who have an immune system that has some recognition of their cancer. And in those individuals, even in advanced cases of cancer, when they receive a checkpoint inhibitor, they can have very dramatic effects. So when we think about one of the most prominent cases in the popular press was Jimmy Carter, who had a very advanced brain cancer. But his brain cancer was recognized by his immune system. He was treated with a drug called Keytruda, which is a Merck drug, and he had a profound and long-lasting complete response to his cancer. Unfortunately, most of those tumors do not respond to the checkpoint inhibitors. They are those colder tumors, and we think VISTA is a big driver in why those individuals don't respond well. So what does VISTA do? Well, here we're looking at a lung cancer. So lung is one of those really prototypical types of tumors that we're talking about today. Most people who have lung cancer have a certain type of cancer called non-small cell lung cancer. Those tend to get diagnosed very late. About 60% of those individuals with lung cancer get diagnosed when they have a locally advanced or metastatic cancer that's not surgically resectable. So those individuals are sort of going down the continuum of chemotherapy and radiation therapy, and they have overall poor survival. And lung cancer is one of these cancers that the immune system does not readily recognize. And it's a cancer that expresses very high levels of VISTA on immune cells in the tumor microenvironment. So those immune cells that are expressing VISTA really prevent the immune system from recognizing that lung cancer as foreign. And that VISTA expression is associated with poor immune surveillance of the tumor, poor overall survival, and really resistance to other types of immune therapies that are currently in the market. So what we've done is we've developed a drug that blocks VISTA. It will help to turn those cold tumors hot. So it will help to blunt the effect of those immunosuppressive immune cells. That tumor will heat up over time. It will become populated with more immune reactive or inflammatory cells. And that will allow that adaptive immune response to emerge. And by blocking VISTA, we expect those tumors to regress and be controlled by the immune system over time. So better, more effective control of the immune system by blocking VISTA. And you can see that here in animal tumor models. These animal tumor models are, I have a couple of different types of models here. So we have some of these colder tumor models, like a melanoma model in the left-hand panel, and a hotter model like colon carcinoma in the right. And what we're really showing is tumor growth in mice that have implanted tumors. These tumors are super aggressive. So typically over 3 to 4 weeks, the mice develop tumors that are so large that they have to be euthanized. So this is a much more rapidly evolving model than we typically see in humans. And what we're measuring there are the rates of tumor growth in sham or placebo-treated animals in black, or in animals treated, for example, in the left-hand panel in red diamonds with an anti-VISTA product. And you can see that that anti-VISTA product actually has a significant effect on reducing tumor growth through that activation of the immune system. So it's not uncommon for us to get a 50% tumor growth inhibition with just an anti-VISTA therapy. So strong single agent activity in preventing tumor growth. In the right-hand panel, when we look at combining those with conventional immuno-oncology therapies, which are shown here in blue, like an anti-CTLA-4 therapy or an anti-PD-L1 therapy, we see those therapies are not adequate alone to prevent completely tumor growth. But when you add in that VISTA therapy, you will see that you get really significant reductions in tumor growth in combination with those established therapies. So one of the things that's really exciting about VISTA is that when you deliver this drug to animals, you get this strong single agent activity, and they work very effectively in combination with established therapies in the commercial marketplace. When we model out what a drug like this would look like, we expect to bring this drug into the commercial setting in 2029. So we expect to complete all of our clinical trials by 2028 and register this drug in the United States, Europe, and Japan by 2029. And that will be the first year of net sales. We think that there's about a $500,000 total addressable market of patients initially. These are patients who have advanced cancer in some key areas that are really representative of colder tumors. So those are prostate in gray, non-small cell lung cancer in blue, ovarian, pancreatic, and colorectal cancer. And that's what's really driving the revenue for this particular product. We actually expect to reach $1 billion in sales of this product through 2031. We expect to have exclusivity around this, so patented medicine protection through about 2041. And you can see that this product, just based upon a total addressable market of about 500,000 patients, can reach a $3 billion product. That's really not atypical for the immuno-oncology space because of the strength of pricing power and the large patient demand and need. And that's one of the things that really is driving the valuation of Kineta over time. So Kineta is one of the few companies that's really looking at VISTA, this novel drug target to turn these colder tumors hot. High VISTA expression does correlate with poor survival and an inability of the immune system to recognize those tumors as foreign. And Kineta, I think, is really well positioned in this commercial space to bring a product to bring a product to market by 2029 and to reach that $3 billion or more in revenue by 2031 in that addressable market, which we showed. Now, in addition to the work that we're doing in immuno-oncology is the primary focus of the company, Kineta has developed novel treatments for chronic neuropathic pain and inflammation, again, focused on the innate immune response. In this particular case, we're really looking at drugs that can help to reduce inflammation in the setting of nerve injury. One of the reasons why this is important is really because of the opioid epidemic in the United States. Generic opioids are very cheap. They're very widely prescribed. There's some generic Vicodin is one of them, probably the second most widely prescribed drug in the United States. And the overuse of these drugs chronically has driven an epidemic of opioid overdose in the United States that leads to 130 accidental prescription opioid overdoses every day. And we've read a lot about this in the paper. The problem of overuse of opioids is actually reducing life expectancy in certain states in the United States because of this, because of these accidental opioid overdose deaths. One of the major challenges really associated with the treatment of pain is that there aren't good alternatives to opioids. So patients do not have good alternatives, especially in the chronic, not acute pain setting, and especially for certain types of pain called neuropathic pain. So this would be something like diabetic peripheral neuropathy. This would be chronic lower back pain, either associated with an injury or not, or just degenerative effects in the spine. And Kineta is exploiting a novel drug target here, which is a non-opioid target called an alpha-9, alpha-10 nicotinic acetylcholine receptor. What's most interesting about this target in this drug is that it actually acts on nerve pain reception in the brain, so nociception. So the drug is really nicely analgesic in all the animal models where we've evaluated it. But in addition to that, it's anti-inflammatory. In this case, the drug actually blunts that pro-inflammatory response around injured nerves. And so over time, we have less inflammation, less neurodegeneration related to inflammation, and then healthier looking nerves over time because of that reduction in inflammation. So a really unique target product profile, non-opioid, none of those CNS related effects that we see with opioids, highly differentiated product in the commercial space. Kineta is partnered with Genentech Roche. Genentech is one of the most famous biotech companies in the United States. They have really brought forward about 9 multi-billion-dollar products over their history. They're a great partner for us. They are emerging in the pain space with a number of novel therapies. We announced this partnership in 2018. We've been working with Genentech Roche for about 2.5 years. It's a very interesting partnership because from a commercial perspective, Kineta has been able to capture about 1/3 of the net present value of the drug through this partnership with Genentech. This is a co-development or option and license agreement. Kineta has received about $21 million in upfront and milestone payments under the partnership so far. And we are eligible to receive in total more than $350 million in development, regulatory, and sales milestones over the life of the products, and up to a double-digit royalty. So this was a very lucrative deal for the company, built on the strength of the novel drug development program that we have for pain. And when you model this out in terms of milestones in the short term and royalties in the longer term that we can get from such a partnership, you can see that even in these types of partnering transactions, when you're able to execute a solid partnership with an established pharmaceutical company, it can drive a lot of investor value for the investors. So the near-term cumulative milestones in the left-hand panel there are bracketed mostly around milestones in the upper range in red and the lower range in blue. But the real value of the program is driven by potential royalties over time and the patent protection that Kineta gets for its drug in the commercial space, which we expect to extend well into the 2030s. And that really drives the value of this product in excess of $3 billion total to the Kineta investors. This drug is currently in clinical trials in Europe. Genentech is funding all of the ongoing commercial development. So the expense line for this product is, we don't have an expense line for this product anymore. Genentech is funding the continued development. And any upside that we would achieve would really relate to the success of the product under this partnership agreement. We have a very experienced team. I said in the introduction that I'm a scientist by training. I've started a number of biotech companies here in Seattle. Our last company was a venture capital finance company that was exited in acquisition by Cubist, which was a public company that was further acquired by Merck. We've done some really high profile deals here at Kineta, including a $520 million transaction with Pfizer and the Genentech Roche partnership I talked about, which have driven revenue into the company and helped to de-risk some of our key activities. And we've really built out the company for an exit this year, either in an IPO setting or in an M&A transaction with experienced pharmaceutical executives like Craig, who you've heard from, who will come back in here in a second. and also members of our finance and legal team. So we're really prepping the company for an exit later this year. We're supported by really an exceptional science advisory board. These are all very experienced and world-renowned scientists and clinicians, primarily in the oncology space, from some of the most preeminent institutions globally, and we're really pleased to have their support of our development programs. So with that, that's a little bit about the science and development of our company. Craig, I think we have plenty of time, so I'll hand it back to you, and you can talk about the exit and financing opportunities for the company.
Great. Thanks very much, Sean. Yeah, I want to talk a little bit about our strategy going forward.
5 minutes, guys. 5
Great.
minutes.
Looking at a little bit of our strategy going forward and talk a little bit about some of the exciting things that are happening in the broader economic market that really impact Kineta. When we look at the number of IPOs in last year, we saw a record number of IPOs, a record number of follow-on fundraisings as well. So it was a really, really robust market and a tremendous opportunity for biotech companies to go public. When we look at the stage of development of those companies, what you'll see on the next slide is that we're really in the sweet spot. Last year, 50% of all of the IPOs occurred with companies who had their most advanced drug at the preclinical or phase 1. And this is a big change from what it used to be a number of years ago, where, a number of years ago, you really looked to have a phase 3 or a commercial drug before a company would IPO. Now, the investment market is really supporting these earlier companies earlier than even we are. So it's a really attractive environment for IPOs. And the other thing that's important is the valuations. As you can see, the average valuation of companies that IPO'd last year in either the preclinical or phase 1 stage was around $550 million. So really robust valuations. Once these companies do IPO, they're also rewarded really strongly in the market, where last year, the average return from IPO was over 50%. So good support to IPO and then really strong support at the time after the company does IPO. And we've also seen a really significant trend in the IPO price versus the filing range. So in other words, companies are also IPOing at a higher price than in previous years versus their target. So again, really attractive. And this really sets up for Kineta what our strategy is. Sean was talking about our programs that are in development. Those programs really support a company like ours to IPO. And so we're looking to IPO at the end of this year, beginning of 2022, really based on the strength of our programs. We have got a tremendous amount of news flow anticipated, in the near term, the next couple of years, but also in the long term as well. So it's a really attractive opportunity for us from a market perspective, but it matches up nicely with where the company sits today, where we can support that IPO. So today what we're doing is we have what we believe is our final round for private investors, where we're looking to raise $10 million. This funding is really going to drive the VISTA program forward. Sean talked about the fact that the Genentech program is fully funded by Genentech. So we don't use any of our proceeds for that. We're really focused on advancing this VISTA program. So we have an open round. We're looking to close this round, the end of the first quarter, beginning of the second quarter, looking to raise $10 million at $2.20 a share. And we would love to answer any questions that you may have live or following this event.
Thanks so much. And I do want to say that the non-opioid pain treatment seems to be something that's very interesting to the group. to a couple of questions offline about it. So maybe that's something that you want to follow through with more information to us. You're going to get all the information about who attends, et cetera, registrants, and you can follow up with them. But in the interim, if you can add, maybe put some comments in the chat